Hi, my name is Robinson, and today I'll be going over some numbology, basic ones for our ultrasound machine. What I'm going to do first is I'm going to delete everything that we have here. So what I'm going to do is press cursor. Now, this is what I use for a mouse. This is our mouse. Select this, I press set, and then I'll put select all, press set. Then after that, we are going to press we go to the delete option and then press set. This answers a question. Exit. Now we exit. Here we have the option to pick our patient and then our probe. Our patient's already set. It's under student. Okay. So then we're gonna go to scan. Now I'm gonna press the probe option. And here we have different type of options that we could get. Right now it's under abdomen. You have the OBGYN, urine, muscles. Here we have the linear option. Let's say you want to go to linear. Disappears, you press probe again. And here we have different options. You have the carotid, you have vascular. These are all superficial to the body, so that's why we use the linear option. But we want to do a deeper penetration. Let's say we want to do the abdomen. We go to curvilinear, and here we go to the option abdomen. Now just let me show you real quick what the options are. Okay, so we go to abdomen, go press set. Now here we have our TGC options. This is, you can move this. I'm gonna have the camera show you on the screen. As you can see, things get brighter. I'm zooming them all in. Look, I'm gonna do the bottom and you're gonna see a white line come over here. It just came up right here. Now, I'm gonna do it darker. See how it's black? Now I'm gonna do the top and I'm gonna make it black. Okay, now show how it looks. Okay, now let me show you the screen. See how it's getting black? This is the TGC. This helps with the shadowing. Okay, now where we want to have it is basically everything in the middle. As you penetrate and you penetrate deeper and things are here a little bit darker, we can always brighten it up. Here we have options to change the frequency, for example. Let's say you want to penetrate a little bit more. You lower it. Now if you want a clearer picture and you have good penetration, you use the frequency and you put it higher. These are other options that we have. Now let me show you something else. This is color. If you want to put color on a certain organ, what I'm going to do is I'm going to show you guys real quick what that would look like. Come here, show the screen. Here we have the color option. And then as you can see, there's color there. Those are like veins and stuff like that it will show. Okay, I'm gonna take this off. And then here we have pulse wave. And here we can see the reading of what you saw right now, the veins and how they are floating and stuff like that. Here we have the measurement options in case you find like a kidney stone or something, you want to measure it. You want to measure the size of the kidney, the liver, anything like that, even thyroid. Then we have the freeze option. You freeze whatever you're scanning, and then after that, you freeze it. After freezing, you take a picture. You press P1 or P2, it all changes. Here we have dual image. This shows one side of the screen. Let's say you're doing the thyroid. It will show one lobe and you want to show the difference, so you press dual and you'll have two screens. And that's about the basic stuff with the ultrasound machine. Thank you.